Well, welcome everybody. Thanks for joining us tonight. We have a very special guest, Sam Oft. I'm going to let her introduce herself here in a second, but we are going to be talking postpartum, and that's going to be overlapping with some pelvic health and return to play. And I'll be honest, some areas that I was not very familiar with. I did a lot of reading and realized that there's some real gaps. And so we're really hoping that Sam's going to fill us in, catch us up. And with that, Sam, you want to introduce yourself to everybody? Thanks so much for joining us tonight.
Yeah, sure. So my name is Sam Oft. I am a physical therapist and athletic trainer in Orlando, Florida. Under normal non-COVID circumstances, I work full-time for Cirque du Soleil as the head of performance medicine for the show Drawn to Life, which is on Disney property. I also own a clinic here in Orlando. We treat mainly performers. There's not very many people in the area that treat performers. So we opened up a clinic. My business partner and I opened up a clinic after our last show closed. So we both been with Cirque du Soleil for almost 10 years. My business partner closer to 20. And we just realized that there wasn't a whole lot of performer therapy in Orlando. So this pelvic health postpartum return to performance interest kind of grew out of needing to put professional performers back on stage in an environment where there's a huge aesthetic component to what they do. And they perform about 500 shows a year and there's no off season. So it's interesting. It's interesting.
Yeah,
I also have 3 kids of my own and I run and I lift. And so this topic hits home for me.
This is wheelhouse for you. So, yeah. So before we get into this, obviously anybody, if you have any questions, feel free to dump them into the chat. And then obviously, as we kind of mix it up back and forth, just remain muted just to keep any noise and overlap. So, but with that, so Sam sent out an article that we were actually just talking about. I was blown away when I read through the article, and that was the article postpartum. Let's see, the exercise in pregnancy and recreational and elite athletes 2016-17 evidence summary from the IOC. I mean, Sam, so first, let's start with the obvious, like the definition of postpartum period. They gave us some domains here. Is that universally accepted? I mean, when we speak of the term postpartum, I mean, I would have thought, well, I guess that's just the time period after birth, but how long does that last? Is there defining points of this? What's your take on that?
So it's a good question, and it's one I can't answer, but I can give you some context. So when you say universal, I don't know what you mean. But I'm going to assume that you mean at least the starting point is the US, because it depends on who you're talking about. So the nice thing about being at Cirque du Soleil is that most of our performers are from all over the world. So their idea of what postpartum leave and what postpartum care and support looks like is very different. So that alone could take us hours to kind of weed through. So I won't get into that. So let's just assume we're talking about the United States for right now. So you're absolutely right. Postpartum does just literally mean after childbirth. So in the US, we see a bunch of different numbers. A lot of times we see 6 or 8 weeks, depending upon how a woman's delivered, 6 for a vaginal birth and 8 weeks for a cesarean birth. But that's just when an OBGYN typically clears a woman to start participating in physical activity. So that's all that is. Depends. It depends on what has happened.
You agree that there's a magic 8-week time point that needs to be reserved from exercise? I mean, what are we talking about? Like these people don't do anything until their OB basically tells them, poof, you're good to go now? Or what's that like?
Sorry, I'm reading Scott's comment. You're absolutely right. It is hard to unring that bell. And no, there's not. And there's one postpartum study that was done on elite athletes, and it shows that they actually return before they got clearance from their doctor to return, and they ended up doing better long term. Now, it's interesting how they defined better, and that's probably a topic for a different day. Yeah. But no, there's no magic bullet at 6 weeks or 8 weeks. That's just when you come back to see your doctor.
Right.
And that's
so that just happens to be the time point. Okay.
And so if you're healed enough, then you can start. What is
Okay.
that exam like? It depends on the doctor. So I can tell you from experience working with my own doctors and with doctors that my performers have worked with, a lot of times they'll go in, and if you've had a vaginal delivery with some sort of perineal tearing, they'll take a look at the scar tissue and make sure everything is healed. As long as you're not bleeding and you are healed, they'll clear you. They do no pelvic health assessment whatsoever for the most part. Now some will, I've heard, I've never seen it though. And then if you've had a cesarean, they'll take a look at the scar tissue, make sure that the scar is healed, and then clear you.
Yeah. So, I mean, I want to get to return to sport here, but it
Well,
sounds
hang
like,
on,
but no, but I
there's
mean, it
more.
sounds like we're not even close to that as it relates to, I
No,
mean, any form of empirical research at all, right?
no, it's not out there. It's just not out there. The what's even more problematic is that 6 to 8 weeks is what people will hear traditionally, but there's more numbers that we have to deal with in our world too. So sometimes we'll hear 12 weeks. Oh, the postpartum period is 12 weeks. And that more typically corresponds to return to work after maternity leave. So now we're not even talking body system healing. We're just talking returning to work, getting a paycheck again. Sometimes you'll hear 6 months to a year, and that depends. That number comes from the American Academy of Pediatrics recommendation for breastfeeding. So sometimes you'll hear that number. And sometimes you'll hear, well, whenever a woman stops breastfeeding and her hormone levels start returning to normal, that's the end of the postpartum period. So you can see there's a huge discrepancy here.
Well, okay. So let me put you on the spot. How do you manage this clientele? Do you care? Are there phases that you kind of anecdotally lump them into based on some clinical factors, presentations, or what do you think?
So I'm lucky because in my environment, I know my people before they're pregnant, right? I know
Right.
them long before they go out. So I have a lot of baseline information on my folks before they leave on maternity leave. And because it's more of a team environment than it is an outpatient clinic environment where you just get people in that you've never met before, it's easier for me to compare their physical performance to what their baseline was. And we have their coach in-house as well. So it's not just on me to assess their performance, but we have a coach doing it there as well.
Right. Okay. So, I mean, yeah, that
Did
makes
that
sense
answer it?
from, no, 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 absolutely. Absolutely. But are you, when you're working with your coach, are you identifying them by phases, or like what criteria do you use specifically regarding postpartum? Are there milestones like when they stop breastfeeding? Are there hormonal testing that they're going through that's saying these values are now within acceptable, like, pre-pregnancy norms, or are you just basically going off of how they feel, or walk us through that?
So can you be tested for hormone levels? Yeah, of course you can, but it's not standard. You don't see that
Okay.
happening very often. There would have to be a reason to do something like that. So we in our environment do a fitness assessment. So much like if you read the paper, what the Army does, we measure their fitness levels when they come back, and we compare them against what they were when they came in, or what their most recent fitness assessment was. And that's a whole battery of tests that our coaching department deals with. But our team brings them back in. We do a full head to toe ortho assessment, and we spend a lot more time talking to mom, trying to figure out what is actually happening in her life so that we can make good decisions about progression, because most of the time recovery is a really difficult thing to manage postpartum. Mom's not sleeping, she may or may not be getting the nutrition that
Mhm.
she needs to fuel the body. So it makes a big difference. But for us, we pay attention to when breastfeeding stops because we do know that there's hormonal implications to that, but also
Mhm.
when they're back to their fitness assessment pre-pregnancy norm. And sometimes they don't get there. So it's not a hard defined thing.
Well, that's the scary thing is, right, reading this
Yeah.
paper, and the question I'm going to follow up after this, so save it in your head, is when do you start exercising these individuals? And we're going to talk more about the complications, but going back to that statement, if you read this paper, I mean, what is it, the third, I think it's the third paragraph, or the third little bulleted chapter here, factors related to maternity exercise. I mean, there's some it says in here 96 first-time pregnant women of this study, longitudinal study, concentric needle EMG test showed partial denervation of the pelvic floor, which with consequent reinnervation in 80%. And another
Right.
study, right, 30% demonstrated denervation of the levator ani muscle at 6 weeks, and only 35% recovered in 6 months.
Months. Yeah.
That seems embarrassingly long. And
What's
also,
more embarrassing is that nobody is measuring this. So half the time, these women are suffering in silence. So they may be dealing with incontinence and they're not telling anybody about it because it's embarrassing.
I was going to say, and that's a social issue, right? Like, I mean, this is an acceptance issue. So
Yeah.
what do most people do about that? Do they just avoid exercise, or are they, I mean, what are the things that you see that maybe we should be on the lookout for an individual that's like, wow, I had no idea.
So that's just a standard part of my assessment when they come back. I ask them a ton of questions about stress incontinence, all kinds of questions. And so usually, so you have to kind of be careful. And this, it seems easy when we're talking about it, but when you're actually in the middle of one of these assessments, it's not quite so easy. You need to make sure that when you do these assessments, you're in a private space and you're not within earshot of a bunch of other people. And in an outpatient orthopedic clinic, you don't often have that opportunity, or especially in a sports environment where in my office, there's 3 tables right next to each other and there's only one private room. So yeah, you have to be really careful. You have to be really careful about this information in general, but you know, because of the social implication of this, most women don't want to talk about this within earshot of anybody else. And you have to be mindful of the therapist that you're assigning to this assessment in the first place.
Right. So, I mean, and again, another issue with, to kind of build on that, is the next paragraph after that, 35% recovered by 6 months. And the following statement says, changes in preparation for childbirth begin long before the onset of labor, which I think is something that we don't talk very much about. I mean, how much,
Anybody
how
who's ever
much
been
of,
pregnant can tell you that.
so I mean, what should they be doing? I mean, what's recommended? Are there general recommendations for that population to kind of
Not
prepare for that?
necessarily. I mean, not necessarily. I mean, it depends on what you're talking about, but sometimes you'll hear, oh, you should start perineal massage in your 3rd trimester to, you know, so if you're going to tear, it's going to be less severe or less painful or easier to repair. But in general, no, there's not a whole lot of recommendations out there.
Well, what do you consider to be some of the more detrimental, some of the more detrimental effects of kind of the postpartum phase? I mean, what are some of those things that you see, kind of the, and you say, wow, this is gonna prolong things. This is going to be an issue. This is something we need to address. Are there hallmark?
Are you talking
kind of,
physically?
Yeah. More. Let's stay physical for now, but I do want to get into psychogenic stuff later.
The psychogenic stuff is really important because that's going to impact your performance, and you're not going to realize that it's happening if you don't think to ask about it.
Yeah.
So physically, if you've got somebody with stress incontinence and you're in an environment where they have to rely pretty heavily on their pelvic floor, that's going to set you back if you don't address it. So what I mean by that is, so I work at the circus, right? We have trampoline artists. We have power track artists, which is just a really tight trampoline, power tumblers. So stress incontinence is life. If they're, that's a huge problem. And they're in wrestling singlets. So they're wearing a G-string and you can't put a Depends pad in those. You'll see it from the audience.
Right.
So dealing with stress incontinence in somebody whose role, it makes them prone to that, is a really big deal. But if they've got pelvic pain in general, that's going to impact performance. You've got to address that right away. And that's not something I do. I refer them out to a pelvic health specialist.
Right. Okay. Well, I don't want to, it sounds like we could get bogged down. I do want to ask one more question before we kind of get into the exercise modalities of this cohort. But before we move on, the psychogenic stuff, like touch on that a little bit. And then I want to follow up with a question about the research, why this is so lacking. Is there some overlap between the two, right? Is because this is a bit of a taboo subject matter and it just kind of been off the center point for a while, or are people not willing to talk about it? Or, I mean, you made a comment earlier to me in a text, like, we were all born, so we got a lot of subjects,
a lot of numbers.
right? So what's happening? But let's start psychogenic stuff first.
Okay.
What do you
So there's a
see
lot
in
to
that?
that's a lot. There's a lot to unpack there.
Sure.
Where specifically do we want to start with this? Do we want to start more how our performance is going to be impacted in
Yes.
ways we might not think to look for?
That's where we want to go.
Okay. So I gave a talk. Let me pull up some of this because there's just a ton. The first thing you have to consider is how expensive childcare is. So
Sure.
it's very expensive. And I know this seems a bit off topic, but a lot of times women on maternity leave, especially in the United States, are not being paid. So if you've got an athlete who's coming back, who's not getting paid their normal salary. So in our world, they get paid a certain percentage of their normal salary. But with athletes, it's very different. So you might have someone who is pushing to get back sooner than their body is ready, sooner than their body can handle. And if you've read that paper, it gives you some good statistics on when some of those things start to normalize, for lack of a better word. It's a lot faster than 3 months postpartum, if that's the number that we're going to use. So you might have someone pushing to be ready at 3 months because they cannot afford to be on maternity leave anymore.
Right.
So that's something that you have to be mindful of. Maybe not in other countries, but here for sure.
Yeah, and then you mentioned something the other day in our chat where, and I actually just made a post in the kind of on the Mobilize platform about Santa and the recovery modalities and all this other stuff, right? But with that, those recovery modalities, like these people aren't sleeping. They're probably eating. I mean,
they're not sleeping. I promise.
Right? So,
yeah, they're not sleeping.
So we're missing the big ticket items, right? Like if you were to
the
poll,
biggest.
right, if you look at the poll that I posted, right, the number one things that we're talking about, right, eat better, right,
yes,
get some exercise and get some sleep. So
right.
we're like missing the big ticket items, right?
So that's another question that I'll dig deep into. I mean, a lot of times people will come over and visit a new mom and say, "Oh, is the baby sleeping? How is the baby doing?" No, how is mom sleeping? How is mom doing? Does mom have a support person that's giving her a chance to rest? And if she does have a chance to rest, is she afflicted with postpartum depression and postpartum anxiety or guilt that are impairing her ability to actually sleep and rest when she is alone? So yeah, you're absolutely right. These are big. I mean, this is a really big deal when it comes to recovery, because you have somebody who is not going to sleep. And for the most part, especially if you've got someone who's breastfeeding, they might not be taking in enough water. And I'll tell you a story. My husband was a fireman, and he used to post me up in the nursery, and he put a little nightstand next to me. We had one of these little diaper caddies. We called it the No Daddy caddy. And literally he put like a water bottle and some diapers and some wipes and some nipple cream, which is a whole different story, right? And some other stuff for the baby, and like 10 granola bars. And all I would eat for 24 hours while he was gone was 10 granola bars. So yeah, nutrition's a problem. You just don't have time if the support isn't there. Unless someone's making you a meal and putting it on your lap, sometimes in those first couple of weeks when it's the most important, you're just not going to get it.
Wow. Yeah. So, I mean, we're talking about recovery from what could have been, what might have been a very traumatic, physiologically demanding process. Psychologically demanding. I mean, all these hormonally demanding. The list is onward. And we're basically saying, like, leaving you to your own devices because the baby's what matters, right? Like the focus is there.
Shifts to the baby,
and mom gets forgotten. Is how this is going.
Usually.
So, I mean, is this a conversation that you're having with your athletes before this occurs? Like, obviously, so like we said earlier, the investment is on the front end. The investment in managing this case is before birth.
Yeah. But I understand that that's coming from a place of profound privilege, that I have access to my folks before I'm the first one they tell they're pregnant, because it impacts their performance status. So that conversation starts right away, but that may not be realistic in an outpatient setting, assuming you're going to get someone postpartum in an outpatient setting in the first place.
Wow.
And that's another problem.
Yeah, well, of course, right? I mean, you don't have access. And so by the time that this is coming to you with this myriad of what it sounds like is pretty confounding, pretty complicated, overlapping, contextual symptoms that you're trying to manage this, and I mean, you're trying to do so and peel back pieces that have been going on for quite some time, and not to mention some of the pieces you can't even change, right? I mean, you can't change that you're not sleeping. You can't change that, right? Some of these other
No.
issues.
But what you can do is be mindful of how you're conducting your rehab, or how their programs are being programmed, taking this kind of thing into consideration. And it has to
Well,
be a group approach. It has to be.
well, that actually pivots nicely into getting into
Oh,
exercise,
good.
and let's get into, right. Well, yeah, I mean, I mean,
Fantastic.
again, this is the world that I know. We've spent the last 25 minutes talking about things that have completely blown my mind. So let's at least talk about some things that I
Scratches
recognize.
the surface, Chris.
so so let's start with, I mean, again, going back to the paper, the one of the paragraphs says, we emphasize that there is no evidence to support this recommendation, and they're speaking about activities to minimize large increases in intra-abdominal pressure, or management ideologies around overloading or loading up the pelvic floor, specifically the levator ani, and strengthening that tissue, and so on and so on. So there's no recommendation, and they emphasize that there is no recommendation, clearly because we don't have the data. So before you answer, I want to hear personally, how soon, let's say a minimally, I don't even know how to define this, a minimal complications birth, vaginal birth, how soon, what's the time frame? How soon are you getting these people back into exercise, and what does that look like?
That's impossible to answer, because it depends it varies so widely depending upon the person's experience. So even in the least complicated vaginal birth, where there's not, let's say there was no birth trauma, right? Let's assume that there, I mean psychological, I don't mean physiological. Let's say there's no psychological birth trauma. You still may have someone whose body adapted in a way that they weren't expecting for it to adapt. So, maybe they gained, maybe there was a lot of weight gain. That's something that you have to consider. It just depends. I mean, I've seen women start exercising 2 to 3 weeks after their baby was born, and that's before they come see me usually.
Right.
And the other thing we have to consider is, in my environment, they're not coming back to start their return process until usually about 12 weeks. Now I'm talking to them. I'm talking to their OBGYN, they're talking to their OBGYN, and usually we haven't talked to the coach at that point. But that recommendation usually comes from the OB, because that's where the access point is. So I've seen it happen that early, and I've seen it go well, and I've seen it go very poorly.
I mean, are there any absolute contraindications? Like, are there any things that you say, these are hard, fast no's? I don't care how good your birth went. It doesn't matter. This time frame, or this thing, this type of exercise is a hard no.
If there's any bleeding, that's a hard no. Because remember, the placenta is about this big, and it leaves a wound you can't see. You can't see that wound. So if there's bleeding, that's a no. And
these are questions you're asking. I mean, you're prefacing this by asking questions about these things and letting them know that this is a no-no, right? This is unacceptable.
Those are conversations they should be having with their doctor in the first place. So it's not my responsibility to clear them for any sort of activity. So let me preface it by saying that. But a lot of times the text messages that I get on my end are, I went for a run today, look at me. And I'm like, okay, mama, but you're not bleeding anymore, right? So it's more gentle. I'm going to be a friend and ask you about some things first. So we want wound healing before any of that starts.
Yeah, well, that makes sense. I mean, again, that's a really good, it's something that I would not have thought of, but thinking about the things that you can't see and the damage that's been done, that you're, again, unable to manage, because it's hard. I mean, again, if you have a paper cut, right, you can manage it, you can see tissue healing.
See it.
But something like this, and so you're having to rely on a person that may have, again, a lot of environmental, psychological pressure to get back financially. I mean, the socioeconomic factors of something like this are quite substantial. So,
It's a big deal.
so are there criteria? I mean, so again, bleeding sounds like one of them. Are there other criteria? When we talk about ACL return to play, right? It's probably the
Yeah.
most popular. Here's some defined things. Again, is it universal? No, and everybody's doing it. However, there are some things about range of motion, strength. What does that entail for you? What does that look like? Or, from a testing, longitudinal, repeated testing standpoint?
So when we bring people in, we like I said, we'll go through a head to toe assessment just to make sure that, and we have comparison information. So we want to make sure that they're pretty close to what they're coming back in at. But there's no documented guidelines out there. I see the chat box popping up here, and yeah, Tom Goom did a nice he did a nice one for return to running, and we actually use that one in the clinic. It's great. But in the circus world, no, that doesn't exist.
I mean, it's extreme, right?
We're talking about. Yeah. So what we're just trying to figure out, can you start a general fitness program? Are you fit to start a general fitness program? And it's usually less about, the extremities than it is about how is your core functioning? Can you do a curl up? Do you have a diastasis? Can you contract your pelvic floor? So we're looking at all of those things to see what the current state of affairs are. So if they've got a large diastasis and they can't do a curl up and they can't feel a pelvic floor contraction, we're going to start by referring them to a pelvic health physical therapist.
Right. What does that feel like? I mean, what's the feedback for that pelvic floor contraction?
So we can do external palpation, but mostly it's coming from mom. It's coming from the athlete themselves. And most women, when they're coming back from postpartum, can tell you they're pretty aware of their bodies. They can tell you if they're able to do a pelvic floor contraction, because most women have done a Kegel exercise somewhere along their, somewhere in their journey. So most of them can tell you that feels normal, that doesn't feel normal. So we can palpate externally. So we'll have them hook lying, knees bent, lying on their side, just medial to the ischial tuberosity, and have them contract. And usually we can feel a little bit of something there. But if mom is telling me, I can't feel that, I have stress incontinence, or I have pelvic pain, and we know she has a larger diastasis and cannot do a curl up, we're going to send them for biofeedback.
Right. And specifically with that, is it a specific, I'm reading a lot about the levator ani, right? Like I'm seeing that pop up a lot. Obturator internus is another one that I've speaking with pelvic floor specialists is another big one.
That one can cause problems.
Are these the culprits?
I mean, yeah, for the most part, you can, yes, but there's a whole pelvic sling there.
Right.
So, even the piriformis is down in there. So usually the ones that you're going to see being more of a problem are the levator ani muscles, but sometimes piriformis is a problem. So it just depends. And that's not my area of specialty. And most of us orthopedic PTs don't go through that type of training. So we don't need to know that stuff. We need to know when to refer. That's important.
Yeah. Well, so Scott made a post just now, and I love it because this is actually where I was going. He said Kegels, the straight leg raise of the postpartum athlete, right? So should we be spending more time on this? I mean, is it worth us devoting time to not only, can you do it? Can you do it well? What's the feedback? Like really get into the nuances of that. Is it worth that?
Yeah.
Like it is in the knee?
So let me give you a statistic here. And I can't remember if it's from the paper that I sent you guys or not, but the statistic is 40% fewer women report stress incontinence at 12 months postpartum when receiving pelvic floor muscle training than those who don't. So does that answer your question?
Sure. But what muscle training though? We're talking about a Kegel exercise, some kind of, okay. All right. And
okay. So that's fair. So specifically what we'll do with people is we'll have a lot of women are very conscious of working their core when they get back, right? Have you ever seen the rubber chickens that you squeeze and their insides come through their pelvic floor? Okay.
Yeah.
You've seen those, right? You can't just strengthen the abdominal wall. I'm never
going to be able to unsee that though. Thank you I just saw a chicken now I can't unsee. All right. Thank you for
But you
that.
know what's kind of what it is. So you spend so much time working on the core and you neglect the pelvic floor. So yes, you have to strengthen the pelvic floor. And it is more than just a Kegel squeeze here and there. So we're working on, first of all, can you do it?
Mhm.
Can you coordinate it with a TVA contraction? Can you do it while you're diaphragmatic breathing? So we'll coordinate those things, and then we can change the contraction type of the pelvic floor. So are we working for endurance? So if I have a hand-to-hand couple and I've got a base on the floor and a woman doing a handstand up top, she may still have issues with stress incontinence, but she's upside down. So gravity isn't an issue until she flops back to the floor. So she needs to stay upright and she needs to keep everything tight so that she doesn't fall over. But then when she comes down, not only does her pelvic floor have to be strong in general, but now she's got the weight of all of her internal organs coming back down on her pelvic floor too. So endurance is an issue. And, we teach them to be, quick, fast pulses. So rate of force development.
Wow. Yeah.
And you
Okay. So that's where I was heading, right? So I think most of us would agree, like doing a Kegel and you do some kind of prolonged static isometric hold, and you can build the time. That seems fairly intuitive and fairly obvious. But when we're talking about like strength, I mean, how do you? I mean, again, forgive my ignorance here, but like, is there weight training for this? Like, is there right? Like, I mean, is there weight training for this? If so, what I mean, I'm going to be honest with you, and I'm going to say
Great
it because I've
question.
seen it. I've
Of
seen
course you have. On
what, like
Instagram,
little
Facebook.
balls or cones that you can insert that provide some kind. Like, is this real? Is
Of
this? I
course
mean,
it's real. You can buy
does
them
it
on
work?
Amazon right now. So can I ask you a question?
Sure.
Would you put a dumbbell in somebody's hand if they couldn't do a bicep curl against gravity?
Well, I mean, okay. I mean, fair point. I agree with you. However, so let's say that they have achieved our baseline Kegeling power, right? Or Kegeling
Yep.
strength. Sorry, it's a bad adjective. Kegeling strength. Then where do you go from there? I mean, you just keep building up the time. I mean, what's
Do
the
we still have incontinence?
modality? Let's say no.
Then no.
Okay, then let's say yes.
Then we refer to pelvic health. That's what it is, though,
Well, I mean,
Like,
again,
look,
I think these areas, for some reason, for most of us that aren't familiar with it, we somehow feel like they don't apply or they don't live by the same contextual rules that a bicep repair would live by, right?
so it's a fair point, and I'm picking on you. It's easy to do, but yes. So if they're working through a pelvic strength program with us, and they've demonstrated endurance that's appropriate to what they need to do. You know what I'm saying? It needs to be appropriate for what they need to do. So if I have a power tumbler who has to do a 30-second line and she gets a very minimal break, she needs to be able to hold her pelvic floor for 30 seconds.
Okay.
So it's specific to what they need to do. Now for a trampolinist, it's different. So they're getting a lot of height, and I'm sorry this is very circus specific, but that's what I know and that's what I've trained. So they have to be very strong at the bottom, but when they're up in the air, they're hanging for quite some time. So it's the training looks a little bit different. But if we've gotten them to the point where they can sustain the contraction either powerfully or from an endurance perspective, then yes, Shelby, that's a good question. That's a good point. Yes, you can transition them to a general program and then work on pelvic floor training as it is functional for what they do. And Scott, I mean functional in the way I mean functional and not functional training functional. So for instance, if we take somebody who's doing handstands, we would work a progression from where they're supine to prone to a plank to an elevated plank, and then start working on a handstand progression. All while doing pelvic floor training.
So it's more.
And I've never run into a situation where I had to recommend a weight.
But they do exist, but you've never used them.
No.
All right. So the jury is out.
Most pelvic health physical therapists I've met haven't used them either. But if
All
we
right,
are
so
genuinely concerned,
we're
there's probably something I'm missing and they need a professional.
well, we're gonna table that for now. I'm not done, but I
Yeah.
need to hear more. I'm just saying, if now that I've said it about 10 times, it's gonna show up on my Instagram feed in about 20 minutes, and you
Oh,
all
your
know
phone
this
is
is
listening to
true.
you.
Yeah, of course it is. So now I'm gonna see these things and think, I don't know. I'm just not sure about these guys. So,
If I can make one more point, and we're
all right,
kind of dancing around it, but we haven't stepped on it yet.
okay,
Postpartum women are easy to market to because they're vulnerable.
that's fair.
So
So wait,
just remember
yeah,
that's a thing.
okay,
And if in your clinic, you're not getting the results that you expect to see, meaning you're still seeing incontinence and you're not getting an improvement in pelvic floor hold time, you need to refer them to a professional. Don't just go
okay.
send them to weighted balls.
Fair play, fair play. All right, with that, we'll leave off on weighted balls. Before we get into our breakout sessions here, Shelby, would you like to? Oh, here we go. Shelby, you had this loaded and prompted. So one of the new things is we're going to start posting some questions to take into the breakout sessions, and Shelby's got a question here. So how has conversation made you consider how you can better treat postpartum female athletes in general? What other questions has this brought up? Yes, so we're going to break out specifically, though, talk about how you can better treat these athletes, start to finish. And then one other question I want to add in is, are most pelvic floor, we'll say pelvic floor pain, do you think that's more of an overuse and underuse phenomena? And if so, why or why not? So with that, let's get into some breakouts. How many do we have? We have 12. Let's do 3 rooms of 4. And bingo. All right. See you shortly. Cool. Cody, if you want to hop in there, Shelby, hop in. Let me see if actually, let me do some wheeling and dealing here. There we go. That's more better. All right. Everybody's got their cameras on now, so you can't hide. This is excellent. Well, any overwhelming comments, thoughts? Anybody?
I have a question for Sam.
Oh, buddy.
Oh shit.
Yeah. From what I gather, just sort of going through, listening to you talk, there's going to be unique aspects to this, but I'm not picking up anything outside of the same clinical decision-making process that we utilize anywhere else. And so the question is, how much of the mismanagement is due to our own, all the myths and realities surrounding this whole concept of birth and everything around it, as opposed to just, this is a part of a medical condition that, there's certain physiological and psychological things that occur when this happens. We plug it into the same process, educate yourself on what to rule in, rule out. If you're dealing with it, know what to look for, just the same as we would say with, ACL or an ankle sprain or anywhere else. Like, is there anything outside of the psychological aspect, which does seem to be much more of a component here? Is there anything physiologically that you would say differs from how you would manage something else?
As a hard and fast rule, not necessarily. But yes, the pelvic floor piece of this is unique. The diastasis piece of this is unique. If you have someone who is breastfeeding, wearing a sports bra that compresses versus supports, that is unique. So there are certain aspects of this that are unique, but most of this is not really having good guidelines to follow and not understanding what to ask and screen for. Tissue is tissue.
Yeah, I think that's what I took as well, Scott, is like, I was thinking the same thing. Like, well, this sounds similar to how we would manage other things. It's just, it has the ability to be very, very, very complicated in ways that are not obvious. Things like again, like the placenta that you brought up earlier, right? That's not something that's obvious to me.
Yeah.
Not having experience in that world. So I think that's the thing, is there are some very, very specific, very unique nuances to this domain, to this cohort of individuals, and we just don't have any data to support it. It doesn't sound like anybody is doing. I mean, is there any research coming out anytime soon, Sam, that you're aware of?
Not that I'm aware
that's being
of.
published that's looking at this?
There was a paper that dropped not too long ago, and Scott, I think you were the one who showed it to me. And I don't know that I actually read it, but I do know that it's sparse. They come out occasionally. I remember like being a kid waiting for Christmas for the IOC papers to drop, but nothing big that I'm aware of.
So with that, I have a few other things, but I want to open it up to any other questions from anybody else. Is there anything that's burning that you have for Sam? Just go ahead and unmute yourself. Yeah. Oh, go ahead.
Let me address something that we talked about in our breakout group. A couple of things. First, when we say postpartum is the period after birth, I want to gently remind you, if you come across this in your clinic, that does not necessarily mean live birth. Postpartum is still a thing with a miscarriage or a stillbirth. And that doesn't matter if it was at 6 weeks gestation or 8 months gestation. So keep that in mind, because physiological changes have occurred already. And it depends on where we're at in the gestational period where the loss occurred. Yeah. So be sensitive to that. A lot of times I've seen this, folks will come back and say, well, I'm not postpartum because I didn't have a baby. And that's just not true. And the other thing we talked about was Kegels being the answer to everything. And obviously that's not the case. So I do want to say that sometimes it makes it worse. Sometimes it makes the pelvic pain worse. Sometimes the answer is not a Kegel exercise. It's not a pelvic floor contraction. Sometimes it is a dilator and a vibrator.
So now we have to spend the next hour
unpacking
that. No, not today, but that's why you're coming back, because we got to talk more about it.
For sure. But I say that because if you have somebody who has hypertonicity, or they have a condition where they have spasm with insertion of anything, it can be a tampon, it can be a penis, it can be a toy, then you may not want to prescribe Kegel exercises because it might make it worse. It will probably make it worse. There's something else happening. So in our world, we are talking in a utopian world where there's no pelvic pain and there's no trauma, but that's not reality.
But this gets
So
into,
be careful.
pelvic, but like you said, like you've said multiple times, this really drives us moving this individual into a pelvic floor specialist.
For sure.
But in our cases, though, we need to identify screening tools that sound like we need to do some research on this, is that to establish some kind of threshold criteria to explain, to manage, and to better stratify these individuals as, hey, this is something that I can see as in somebody not a pelvic floor specialist, but I can manage with these things. And or no, this is not going to be a successful case if you stay with me. This really needs something a little bit more
For sure.
specific.
So I think some of that was in jest, but I just want to make sure that I cover that base. It's not always the answer, and sometimes it's the wrong thing to do.
Well, that's something I want to bring up later. I mean, we're going to have you back, and we're going to do more of this topic specifically, because it's just, again, it's something that needs to be addressed. But that's a really good point, and something that I'm looking forward to talk, to discussing a bit more. But is there anything else from anybody else, the breakout rooms, or any specific questions for Sam that you may have?
Don't be shy. If you ask, I'll answer.
And this isn't necessarily a question, it's more just thank you for, I think, kind of reminding me of the importance of some of like the deeper like core musculature that I feel like I've just personally neglected, and I'm more like general population or general athletic population. So thanks for bringing that up. And
yeah, of course. I mean, who sits around thinking about the pubococcygeus all day long? Probably no one.
definitely not myself.
Me, honestly.
Well, with that, like I said, we're right on time. Sam, it has been an absolute pleasure, and really, really insightful, educational. I mean, I'll never be able to think about rubber chickens anymore, but that's neither here nor there.
You are welcome.
Yeah, I guess thank you is the, yeah. Anyway, so
It
guys,
works.
like we've said in the past, feel free to shoot any messages along to Shelby if you have any other topics specifically about this area, or you'd like to hear more from Sam in the future. We're certainly going to have her back. But if there's things burning, questions burning specifically, write them down, send them along, and let us help you work on that. But with that, Sam, I'll open the floor to you for final words. But thank you very much for coming on. It's been awesome.
It's absolutely my pleasure. And I know that this kind of a topic can seem a little bit niche, but women have been having babies since the beginning of time. This is not something that should be niche. It just shouldn't be. In these conversations, I get that they're uncomfortable, but they're so important. And don't forget, like, if you have somebody who is not performing the way you expect them to be performing, there's so, like, especially with something like this, especially with postpartum health, there's so much that lives underneath the surface that impacts performance.
Yeah. Well said, Sam. And again, thank you again. And thank you everybody for joining us. We'll see you in a couple of weeks for the next one. Thanks again.